Dr. Mulholland coming at you from Washington, D.C. We are doing a live quantum non-lipo fat reduction treatment. This is the fastest growing treatment in the world. I predict it's going to be 5 times more popular than the Morpheus, which was 1.3 million treatments in 2023. Now, the thing about the quantum, we need local, because we are going deeper than the Morpheus. It's kind of the deep Morpheus, and we're killing fat, and that don't feel good. So we need to use some local, not tumescent like you will with lipo, but anesthesia that's for comfort. So the first comfort management tactic in my practice is going to be nitrous oxide. 50% inhalational nitrous oxide. And so we're going to use this nitrous oxide, nice, slow, deep breaths. Now, zoom in a bit if you can now, Quan. There we go, coming off this young lady's face here. Now, we can be using this clip on the nose. However, come up to the side there a bit. There we go. Perfect. The clip on the nose is uncomfortable. When I do that, some people get like nasal claustrophobia, or they don't have a big tip and they kind of slide off. So these are kind of like medieval torture. So I'm going to give those away. And what I use, and why do I plug the nose? Because I want pure 50% nitrous oxide coming in. I use these little nasal plugs. And these little nasal plugs I got from my good friend Jeff Bezos sent me these. One in one side and one in the other. And of course, Jeff is a big fan of modern politics and the Washington Post, and he took a real strong stand on what he believed in, which is awesome, which is shipping me these little plugs. And so this is not a political event. This is all about aesthetic medicine. A nice, deep, deep breaths of nitrous oxide. Now she's got surging serotonin and dopamine. She's flying across the universe of less bumpy her. And she's going, I can feel this, but I don't care. It's like inhalational dopamine and serotonin. It's a sense of well-being. Okay? So while she's a little bit high now and having fun, isn't that great? You're making her look good, give you some money, and she's having fun all the time. And so let's take a look at her tummy. And we saw what we did before. So Quan, if you can now come in off the tummy. Beautiful. So give me a pair of gloves there, young lady. And so this, can you come up higher, Quan, and come down on it a little bit? Are you able to do that with your great big instrument? Very good. Perfect. Okay, that's very nice view. So we don't need to do this in an OR. This is like Morpheus, side office treatment. It's got to be a sterile technique in a clean environment, just like you're injecting an HA gel or sculpted radius. You're putting a cannula under the skin. And so I use sterile prep, just like if you're doing a filler or suture suspension. And I do a square drape like I was taking out a mole. That's it. Side office local anesthesia, sterile technique. So you don't need to do this in an OR. Of course, you can do it in an OR if you're a surgeon, but it's made for side office delegation. So we got our pinchable areas, okay? And we pinch them. We've done our pinch pulse count, a little local anesthesia. And so we're elevating this way more than we need to, because this is what the pack comes with. I just use square drapes typically. And so you can do this in your side office. I mean, I would never do this in a Sheraton or a Westin, but we're doing it at a Fairmont, which is okay. Fairmont, Four Seasons, Ritz-Carlton, your side office. Now, we're going to make a square drape, of course, but we do need a sterile prep because I'm putting a small cannula under the skin, kind of like you're injecting radius or sculptura. And so I'm taking this chlorhexidine. You can use betadine if you want. I like the clear chlorhexidine or the pink version. And we take our chlorhexidine and we use prep and drape. Now, I used a bit of Sharpie color here. Don't use Sharpies, because if you go through where a Sharpie is, you'll create a little traumatic tattooing that may last a long time because it's not terribly water soluble. And so we want to make sure that typically you're using a surgical marker which is water soluble and goes away. So if you go through one of the pen marks, it doesn't leave a traumatic tattoo. And that comes with your surgical pack as well, but doesn't show up as well as the Sharpies do. Okay, so we're gonna make a little square drape so we can go at these 3 little post-lipo tummy bumps, which are, common area. The tummy's the commonest area. So you can use disposable blue towels, which come with a little strip, or if you have a laundry service, you do your own laundry, you can use a green towel. Much more common to use these little disposable packs where you peel it off and just, they become part of your disposable. Okay, so what do we need to do? Well, first of all, we want to do our pinch test before we do our local, and we go to our pinch pulse table, and we already determined this is about 200 pulses, 200 pulses. And then we use a little local anesthesia. The local anesthesia is going to be as follows. This is our little injectable mesotherapy lidocaine. Each one of these is 31 gauge, 5 millimeters long. Give me the bucket. And I've mixed up 500 cc's with two 20 ml lidocaine bottles. Each is 20 mils of lidocaine with 1% epi.